my name is Sally, and this is my bed bath video. I would start first by verifying doctor's orders to make sure that Mr. Smith doesn't have any contributing factors that would hurt him if I give him a bed bath. Neuropathy, diabetes, and such, soak in his limbs. He does not. So I would then gather my supplies. I have a sheet, gown, soap, lotion, washcloths, towels, and a basin with 3/4 of water. Okay. I would then bring my supplies. I have gloves as well, and I have a dirty linen cart right here. So I would push my supplies, knock on the door, and introduce myself. Hi, Mr. Smith. My name is Sally, and I'm going to do your bed bath. Is that okay? He states yes. Can you tell me your name and date of birth? And he does. So I would verify it against his ID bracelet. Okay. I would then wash my hands. I would wash my hands, and then I would raise the bed to a comfortable working condition. Now, Mr. Smith, do you have any problems with being flat on the bed or turning over? He states that he wants to keep his pillow, and that's okay. Can you turn well? He says he does. He can. So I would lower the rail on my side, the side that I'm working, and I would put a towel under his head. Mr. Smith, can you lift your head? Thank you. I would do that. I would then proceed to ask him if he could test the water. Can you test the water and make sure that it's warm? He tests the water. It's good. So then I would dry his hand. Say, wash the washcloth. Put it in a mitten. Fold it in a mitten position. And then I would wipe his eyes, working from the inside out, inside out. Mr. Smith, do you want soap on your face? He does not. So then I would proceed to wash warm water again. I would clean his forehead, his cheeks, his chin, inside of his ears, outside, inside, out. Clean under his chin and his neck and such. And then I would go ahead and dry it. Let it dry. Under his ears and so forth. Okay. Okay, I'm going to go ahead and wash your arm. So I would put the towel. I would, okay, first I would go ahead and take with my clean sheet, I would cover him. I would then undo his gown and the other side. Okay. Mr. Smith, if you'll just grab the top part of that way I can remove these items away from you. Okay. Okay, I would then uncover the limb that I'm going to work with, and I would put a towel under it. Here. And put some soap in there and wash his arm from his wrist to his elbow to his shoulder, and then his hand really well, being careful to get in between the fingers and nails and such. I would then dry the limb off. Being careful to dry in between his fingers really well. I would then, if he is mobile and capable, because some people have problems with motility, I would go ahead and raise his arm above his head, and then watch his axilla really, really well, and then dry. Really good. Okay. I would then, Mr. Smith, I'm going to wash. I would then go to the other side and perform the exact same thing. Wash from his wrist to his elbow to his shoulder, his hand, dry really well. Okay. And then I would say, Mr. Smith, I'm going to go ahead and wash your chest, if that's okay. I would lower the linen sheet a little bit over here. Get some warm water. And then I would long, firm strokes. And then I would dry. Make sure that he's dry really well. I would then lower the bed sheet to the pubic, right above the pubic area. Place a towel over his abdomen. Get some more warm water. And wash his abdomen. Long, firm strokes. And then dry really well. Okay. I would then come to the bottom and uncover his leg. I'm going to go ahead and raise this rail because I'm going to be working on the bottom part. So I would place the towel under his leg, his limb, uncover the limb that I'm going to work with, put the limb over the towel, and again proceed to get some warm water. Wash from his ankle to his knee to his thigh, and then wash his feet really well in between his toes and dry really well. Dry the limb off really well. I would then proceed to do the same on the opposite side. Ankle to knee, knee to thigh, and then his toes and feet really well. Okay, I would make sure that dry, especially in between the toes and such. While he is in this position, I would provide perineal care, him or her. If this was a female, to wash under the breast, you use the back part of your hand to push the breast up while you clean really well and then dry. If it was an unconscious patient, I would wash with warm water from the inside out of the eye, inside towards the outside. And then if they don't have a blinking reflex, you make sure that their eyes are closed. You would provide drops or ointment at this time if it was ordered. And then when you put the bandage over their eye, you make sure not to tape the eyelids shut. Okay. So so we've gone through the body. He's had perineal care. So then I come over here, take off my gloves, with this washcloth and the dirty linen, and go wash my hands. Fill the water basin back up with clean water, and then clean warm water with some soap in it. And then again, I would say, Mr. Smith, can you turn away from me and hold on that side of the rail? I'm going to wash your back and your bottom. So I would put my gloves on. Okay, I'm going to pretend like this is new. I would get, once he's turned, I would wash his back in long, firm strokes. Long, firm strokes. And then I would dry. I would pat dry. Okay. And then moving to his bottom, I would make sure if there was any fecal matter, I would wipe it with a disposable wipe really well. And then I would proceed to clean it with the washcloth really good. And then wash and rinse. And then I would pay special attention to any folds and so forth, to wash real well and dry real well, especially folds, because if you don't, you could get a yeast infection and such if you just leave it moist. But okay, so then Mr. Smith, can you roll back this way, please? So he's rolled back and he's supine position again. So then I'm going to go ahead and put your gown on, if that's okay with you. A new gown. So gonna dressing the unaffected side first, if he had an affected side. So put on his gown. And then I would go ahead and remove everything that I put on him. And put it in the dirty linen. And I would not put it by my chest. I would just put it in the dirty linen. And then I would cover him up. Then I would, let me have that towel, please. Thank you. Put that in the dirty linen. Do you want me to put your deodorant on you? He does. So I put deodorant on both axilla, and then I'll take the lotion, which is warm from the water, and lotion his arms and legs really, and his feet really well. Everything is good. Did you want to shave? I think he stated no already, so I said, okay. How about you want me to comb your hair? And so he does. So then I'll comb his hair, however he wants it combed. And then I'll, make sure he's covered up right now. And then I would make sure to raise the rail. Lower the bed. Raise his head to a 30 or 45 degree angle. Raise his feet a little bit so he doesn't slide down. I would make sure that his collite, this is collite, is where he can reach it. And then I would gather all my supplies that I brought in and leave the room. Mr. Smith, is there anything else I can get for you? I would wash my hands probably again. Is there anything I can bring you? Some water, some juice, a Coke, anything to drink? He states no, that he's fine. He's going to try to get some sleep. And so would you like me to turn off your light? He says yes. So I'm going to turn that off. And then I'm going to exit out of my video. Thank you.